Hello, my name is Vic. I'm a midwife who works in abortion care. I am wearing too many clothes for a dog walk. I just had a message from someone who has previously had a it sounds like traumatic medical abortion, and has also now lives in a house with lots of housemates, so isn't sure, basically has to share a loo with 6 other people, which obviously is going to be tricky if you're going through a medical abortion, because obviously you're going to have bleeding and lots of people get really sick and have diarrhea and stuff like that. So basically asking, is it okay to opt in to a surgical abortion? Now, the simple answer is yes, you absolutely have the choice which type of treatment you have. It kind of depends on the practitioner that you speak to as to how choicey they are. But what I would say is, if you speak to someone who is adamant that you should have a medical abortion, even when you know that it's not the right choice for you, please understand that you don't have to do what they tell you. If you feel like they are not giving you appropriate choice, please ask to speak to someone else. If you feel like you are being kind of moved towards one type of treatment than another, again, ask to speak to someone else, and just really make it clear why you're asking. It's absolutely valid to choose to have a surgical abortion. Just bear in mind, if you're very, very early in your pregnancy, there can be some complications. So before kind of 7 or 8 weeks, it can be quite difficult to make sure that you've got the whole thing. So it means that sometimes you might need to have further kind of blood tests afterwards and stuff like that. And just a follow-up to make sure that the treatment was effective and successful. I think surgical option is a really good option, because you leave the clinic knowing that you're not pregnant. You leave potentially with whatever contraception you want. So if you wanted a coil fitted, that is the perfect time, because you're unlikely to kind of feel it. So if you're worried about the pain of having a coil fitted, this is a really good time to do it. But yeah, and it should be funded in the same way as any other abortion. So yes, you can ask to have a surgical abortion. Just bear in mind as well, the other thing that's annoying about them is that sometimes you have to wait for an appointment, because they obviously only do surgical appointments on certain days, whereas tablet treatment you can have straight away. But yes, the answer is yes, you can have a surgical abortion if that's your preferred choice.